Well, healthcare continues to be a big concern and a big debate on Capitol Hill. Recently, an ETSU professor went to Washington, D.C. to meet with political leaders about the challenges surrounding rural public health. Certainly something we see a lot of here in our area. That assistant professor is Dr. Nathan Hale, and he joins us this morning to tell us more about that particular meeting. And Dr. Hale, it's great to have you on the show.
Oh, thank you.
Thanks for being here. So you went to Capitol Hill, met with some of the lawmakers, and it seems like a lot of times when we talk about healthcare, we're focused on the metropolitan areas, the big cities.
Yeah, that's very much true. And, you know, honestly, I grew up in Eastern Kentucky, particularly in Central Appalachia, so I have a pretty good handle on what it means to live in a rural community and some of the challenges that rural communities face relative to urban. So that's a lot of what we talked about when we went on these visits. So we met with 4 policy advisors for some of the ranking members of the Senate Health, Education, Labor, and Pension Committee to talk about a lot of the issues that we see in rural and how they're very different from urban and some of the strategies that might come along with how to address those.
And you said you don't want to assume that they know the obvious, because sometimes they don't.
Yeah, that's true. And we spend a lot of time talking about some of the basics. And really at the most fundamental level, we know that our friends and family who live in rural communities tend not to live as long as our urban neighbors. That's something that we're obviously concerned about, but what's interesting is it used to not be that way. 50 years ago, life expectancy was pretty much the same between rural and urban communities. So fast forward 50 years to the present, and we've seen urban communities really kind of pull away from rural as it relates to how long we live and how healthy we are in the long run. So as it sits now, we're about 2, maybe 3 years difference between rural and urban communities.
Wow.
But what's interesting is when you kind of step back and look at what's driving that difference, a lot of it has to do with things that look very familiar to those of us who work in public health. There are things like accidents that are unintentional, things like smoking-related illnesses, lung cancer, COPD, and other chronic conditions that tend to be more prevalent in rural, things like cardiovascular disease and diabetes. You know, those things alone account for about 70% of that gap that we see between rural and urban communities.
So is it education or access, or a little bit of both?
Well, that's a fairly loaded question, and the answer is it's a little bit of everything. I mean, I think that they're all very much related. Certainly there are short-term, strategies, programs, and policies that can be done to address any one of those particular issues, but I think the challenge that we face is at the end of the day, the health of communities is ultimately going to be influenced by how educated the population is and poverty. It's really hard to kind of get away from the fact that those two things have the biggest bearing on health. In fact, education is the single strongest predictor of how healthy you'll be and how long you're going to live over the course of your life. So those are things that have to be addressed, but they're also the most challenging to address, which makes it very hard. And for those of us in public health, we are just kind of coming around to working in that domain. Like, that's kind of not always in our area, so we're trying to get a little bit more proactive in reaching out across public health boundaries to housing, business, things that we normally don't feel comfortable working with, because ultimately at the end of the day, that's what it's going to take to really advance the health of rural communities.
And Dr. Hale, obviously already making some progress, at least opening the doors of communication and getting those needs addressed.
Very true, yes.
Yeah. Wow. Well, you'll have to keep us posted on your next trip to D.C. and how well that goes. Thanks for joining us.
No problem. Thank you.
You can always check out ETSU's website for more information on public health.